Financial toxicity. It's not well defined, but generally in medical terms, a broad detrimental effects happening from financial strains due to medical care at the patient, family, community level.
We've had to make a lot of financial decisions based on what we can afford after taking care of our daughter. As a young family, just starting out trying to find our place in this world, it is very difficult financially. Her life-saving treatments are $8,000 per treatment.
This is a Nobel Prize winner, Leon Lederman, who in 1988 won the Nobel Prize in Physics for discovering the God's particle. 17 years later, he had to sell his Nobel Prize gold medal for $765,000 for his medical bills.
The financial aspect of things needs to also be considered, that in this day and age and the economic structure that we are currently in, that medical treatments and medical financials can be a big factor into poverty.
1 in 7 families with patients with ACVD are spending 20% of their combined income on healthcare because that is considered a definition of financial hardship. About 5% are spending 40% of not their income, but their entire family income on this. And it's not equally distributed. The unfortunate thing is that low-income individuals are 4 to 10 times more likely to spend that of their income. They're doing so by using their credit cards, asking friends for help, negotiating with hospitals, and actually about 20% are unable to pay bills. One thing that really surprised me was 70% of these patients are actually insured. So as insurance companies are making billions of dollars of profit each quarter, they have created a new phenomena of underinsurance, the whole thing that was created to protect us. 70% of all people who are financially hardship are actually insured.
The most difficulty that we have faced would be financially and through insurance, finding creative ways to make insurance work for us. If it wasn't for Dr. Brinton and his not-for-profit status, we wouldn't have been able to afford treatment at all. He worked in such a way that he took the brunt of our out-of-pocket and then broke it up into monthly payments so that we could spread that out over the course of the year. And that was the only way that we afforded her treatment, her LDL apheresis.
So for those individuals who are unable to pay bills, about 48% have cost-related non-adherence. Not only that, they have significant financial distress thinking about rent, about sending their children to college, retirement, and putting food on their table.
There's no amount of money in this world that I love more than my daughter and her care. There is already a lot that needs to be considered when it comes to medical, but we need to keep our human element and compassion and curiosity to make good things happen and make medical treatment sustainable for everyone.